name's Tyler. I am a survivor of psychiatry, and moreover, a survivor of being institutionalized in state mental health institutions. Um, so, I am going to be delving more into my experiences and my story as a former state hospital consumer who has not only survived but grown critical of this entire system. I will be upfront and warn you that there will be many heavy topics, including just what those institutions are like, um, suicidality, particularly as it relates to psychotropic medication, um, and just how risky that can be. This is going to be very heavy. So, just a forewarning that these experiences are difficult for me to not really share, but it's not something I like to reflect back on because I don't reflect back on it fondly. And in fact, I do have PTSD as a result of my history with psychiatry and ultimately these institutions. So, I'll start with a brief background. I am a 36-year-old man who has, as I stated, survived this horrible mental health system. I am highly critical. I am not uh, one of these people who brown nose the system. If you've seen other videos or comments that I've made, I am not anti-psychiatry. I am critical of psychiatry. I follow channels such as Dr. Joseph During, and I am not pro medication, and I am not pro involuntary commitment. So, I was diagnosed as a late autistic individual, level 1 autism service disorder, and that was at 17 years old. Before that, I was given all your typical diagnoses that pathologize the normal human condition: obsessive compulsive disorder, oppositional defiance disorder, attention deficit hyperactivity disorder. In my teens, I accrued diagnoses such as generalized anxiety, major depressive disorder. I had Tourette's, which I believe were or may have been caused by just being started on heavy stimulants such as Ritalin, Adderall, Concerta, etc. To put it bluntly, I was on a merry-go-round of drugs, psychotropic drugs. I was on a merry-go-round. I was in and out of children's partial hospitalization, children's acute behavioral health. I've experienced a whole bunch of a little bit of everything, more than I probably should have. So, one thing that occurs when you are in the system is, as I said, you're started on a merry-go-round of medications. It's the euphemism describes what's set into motion. You're started on something, you start having symptoms, you build up tolerance, and then it snowballs until you're being put on every drug under the sun, and they up the dose, find it doesn't work, switch to something else. Oh, maybe try this again. It's a messy fucking system. And personally, I don't buy the whole imbalance of neurochemistry. I believe that these disorders are real, but they're more maladaptive, and certainly not anything like obsessive compulsive disorder or oppositional defiance disorder. I believe those to be more playing on pathologizing aspects of the human condition. ADHD pathologizes a child's inability to pay attention because they're not interested in what they're being taught in the schools. Homosexuality is another even bigger example of a disorder that was pathologized. Women menstruating and being irritable from it, pathologized. So this is the stance that I take going in. And to be frank with you, this is all necessary context that I can give you, that gives you an insight as to how I view things and just how critical I am of things. I was also I was diagnosed as intellectually disabled as a child as well. So you see an intelligent man sitting before you right now, essentially giving you his story. So, and that's because neuroleptics, antipsychotics, whatever you want to call them, they can disinhibit you. They can lead to cognitive decline. They can cause brain shrinkage. So I was not in my right frame of mind the whole time I was on these medications, which, mind you, I was able to successfully taper down and come off of with the support of my mental health and medical team, and different people in my life supporting me. So, that having been said, keeping in mind just how fucked up your neurochemistry can get, many of these drugs, these classes of psychotropics, have black box warnings. Some are for increased suicidality in teens and young adults. I was in my early 20s when I was ultimately sanctioned to be sent away to state institutions. So let's talk about them. What are state institutions? Well, first, to talk about what they are institutions where you are sent if you are found not guilty by reasons of insanity, or you are too much of a stress on the acute behavioral health system. I was that patient who was just too much of a burden on the system. So off I went. Now, contextually, that suicidality that I mentioned that could be caused by the drugs, yeah, I believe that was at play because I had numerous attempts. There was little in the way of what was going through my mind. It was just a sudden blindsiding impulse where I had zero thought or consideration. Some people might describe it as somebody else being in control entirely. In any case, I wound up in the state institutions. or state hospitals, as people call them colloquially. State asylums, whatever term you want to use. But the point being that these asylums, which is what they were in their heyday, were they used to be far more ubiquitous, but that is not the case. Understand that they operate in a far more limited capacity. So, I was a burden on the system, and I understand that. But even still, I was sequestered away and left derelict in these state hospitals, because that's what they're formally called right now. I was left derelict in the asylums, and I'll be real with you, it was scary. It was traumatic. And it was painful. They may not do leucotomies, lobotomies, or anything like that. I mean, ECT is still in use, to my knowledge, in more acute settings, but in these, you're locked away for as long as they feel that you are disabled or ill. And I'm not going to go into the history of these institutions, other than that they were self-sustaining in their heyday, and they by and large deinstitutionalized people decades ago. I don't remember the exact time frame, but that's essentially what had happened, and that's why there's more community mental health. These places were shit shows, horror shows. I feel in general, just being evaluated, looking back on being evaluated in any given emergency room or setting, that I was viewed kind of like a caged animal, or just like an animal in general. Not him again. Fuck. It's not a very fun feeling. It's not a very pleasant experience, being viewed as the frequent flyer. And in the state institutions, as I said, you can be sent there on a civil commitment, or you can be found not guilty by reasons of insanity and sent there. Either way, you're in it for the long haul, and I had no idea what I was even in for. And let me just preface this. I was already developing things like type 2 diabetes, thyroid disorders, metabolic disease, massive weight gain from the psychotropics already. I already had next to no inhibition to think, let alone critically, about my situation and why these things were happening. And I say this because I was viewed as intellectually disabled, which, spoiler, that's a load of horse shit. I never was intellectually disabled, with the exception of being under the influence of the psychotropics, and particularly the neuroleptics, which are known to cause those sorts of disabilities. So, going into these institutions, I was sent there from an acute behavioral health unit at a local hospital. They had an ambulance drive me several hours away to this asylum. I was strip searched when I got there, and you have a medical team. You have like a physician, a psychiatrist. When I say physician, that's more for like medical clearance or medical needs. Just for clarification, you have your basic amenities like a dentist, a barber, things like that. You have like a canteen, as I've heard some correctional institutions actually have. But moreover, this is your prison for the foreseeable future. Um, Most units might have you eat on the ward itself. When you first arrive, you will be restricted, but eventually you can gain things like a belt, shoelaces, things like that. Just the basic things that you should have in general. Sorry, I was just adjusting one of the plugs that was falling loose. But yeah, you have your basic amenities, and on the surface it seems ethical, but I've had experiences where I would be denied a meal as a full-blown type 2 diabetic, all because I missed the call to line up, because they do have a cafeteria once you gain the privileges to go downstairs and eat. And intermingle with other units or wards. And I missed the call to line up, and I didn't get to eat. I mean, I know that's a common experience in correctional institutions, but it seems a bit negligent. On top of that, at one point I had a dental issue, and because they were trying to find a new dental provider to come on board, I was left sitting with an abscess for well over half a year in excruciating pain, and they wouldn't take me to an outside dentist, not until I was seen by their dental provider. Little things like this. I mean, we can go on about how it's bureaucracy, red tape, and all that shit. I don't really give a fuck. You mean to tell me that I have to sit there and essentially wait to go into septic shock or have some sort of major infection before anything is really done, and the only thing that you would really do is just send me to the local hospital for treatment to save my life, and then no dental care when I get back? Oh no. And on top of that, it didn't feel like a healing environment. The nurses, the doctors, they felt aloof. They felt like, that you were just another dangerous, gravely ill consumer. And yes, there are times where patients could get aggressive, and myself included, which is regrettable. I mean, there's no excuse for it, but I was not in the state of mind to really think about what I was doing. In a lot of these wards, people might not even be cognizant of the fact that they are in such a ward, or, why. There's people who would pace. There was obvious cases of akathisia, tardive dyskinesia. There was people who were in despair because they had no idea when they were getting out. In fact, I was in despair. I had no idea when I was getting out. All I knew was that I was in here, and I had no idea for how long. It's a scary experience, if I'm being honest. These wards, even more so than an acute behavioral health unit that's meant to stabilize you, they were quick to jump the gun on injecting you for any little thing with an IMB 52, haloperidol, Benadryl, and I think Ativan. That's what they would typically mix. But um, you were very quick to get an injection if you were falling out of line. They might not lobotomize you, but it felt like a very controlling environment. And on top of that, the feeling of being infantilized and everything you do being scrutinized heavily is just jarring. It's scary that I spent 4 years despairing away under such circumstances. The programming is not really conducive to recovery. I mean, can you honestly sit there and say that crushing used soda cans in a workshop in the basement is conducive to mental health? I mean, yeah, you're busy, your mind's off of things, but how realistically does that do anything? Or just going on about, oh, it's Donut Day today, or oh, it's Feline Day, or whatever stupid shit they were coming up with. I know that that a lot of the occupational therapists, a lot of the people on staff were just trying to keep us entertained, but how does sitting in a group watching old television shows like I Love Lucy or Gilmore or Golden Girls or whatever the fuck old show they had on, how is that conducive to recovery? Where is the actual work? I mean, groups were not even about processing emotions or things like that. Yes, they had things like dialectical behavioral therapy, which is all well and good, but the majority of it was just stupid filler. Like, oh, we're going to teach you how to build some stupid little simple craft with straws or some shit. Or, if you're lucky, you'd have like a painting or an arts and crafts style group. But a lot of the time it was just, oh, we're going to head up to the library, or oh, we're going to go down to the community room and watch a movie. Very little effort. It felt more like they were focused on babysitting us than actually giving us information and tools we need to recover. Which again, considering the state of people in there, those people have been drugged so horribly that you would be justified that if you thought that, hey, these people look like zombies, and myself included. So how about pull back on the drugs and do some actual fucking programming? I mean, it's ridiculous. And even more is that I was on a civil commitment, so, I'm only speaking from that perspective. But if you are found not guilty due to reasons of insanity, you don't know when you're getting out. And it's even more serious because you are alleged to have committed some crime, no matter how minor, and you're sent there. It could be murder. It could be a simple theft. It could be a grand theft auto. It could be burglary. Any little thing that they decide, if you have a mental health history and they feel that, an insanity defense would be the way to go, I would honestly advise against it if you're going in for a much shorter sentence. I mean, the way I understand it, you're often waiting for beds in county lockup. You're waiting, and it might even take a year before you get a bed at a state hospital. And I would say just take the time in the correctional institution, because if you didn't do anything serious, you'll at least have a time frame of when you're getting out. For me, as a civil patient, I was told around 6 months, and then that should be it. But When 6 months rolled around, they held hearings to recommit me. And that's typically the process that they do, regardless of why or how you were sent in there. Now, to clarify, it's not like they're going around with the band saying, hey, we're going to kidnap you and send you to an institution like this. You have to be a burden on the system, or you have to be a burden to the community with your criminal activity. But again, it's not very well talked about just how these institutions are still in operation, albeit in the limited capacity that they are. There's no overcrowding like the days of old. There's no insulin shock therapy, leucotomy, lobotomies, physical abuse can still occur. Mental, verbal abuse can still occur. Neglect still occurs. But the more extreme treatments that they used, such as heavy restraints, to my knowledge, are not used as much. Chemical restraints, another situation entirely. And many people would fight in there. Many patients fighting themselves and the staff, and that includes myself on both fronts. And I was just disinhibited. It was to the point where if I had a weapon or anything, that I would have, there wouldn't have been any thought. I would have been bang, gone, just like that. So, and this might be controversial. In fact, it is. But I fully believe that psychotropics can disinhibit somebody to the point where you do hurt yourself or others in mass murders, mass shootings. I believe that they can occur from being disinhibited on psychotropics. You got to remember that your neurochemistry is fried to hell and fucking back. You're not thinking, you're impulsive. There's no thought or reason or logic or anything in your mind. It's frankly fucking scary. And I've experienced it. And I was that patient who was deemed gravely disabled, mentally retarded. I was viewed through that lens. And ultimately, I did wind up surviving. I did wind up getting out eventually. I felt like those 4 years were just lost. All because of what I believe were psychotropic drug-induced suicide attempts. Effects of medications that, realistically, we should be more hesitant to prescribe. And it pisses me off, honestly. These are not safe drugs. Look at the black box warnings. Look at just how disinhibited people can become. The fact that I can sit here before you leading a relatively normal, sane life is a testament to just how far I've come. I used to be overweight, and if you look at me now, I've gotten in shape, gained some muscle and definition. Like, I put in the work to lose weight. My mental state is far more sane and stable. I'm not some Looney Tune. I mean, I don't really like using that word, but I have come a long fucking way from being the mentally retarded, gravely mentally disabled consumer who was disinhibited, made many attempts to off himself, and just, I've come such a long way. I've reversed the type 2 diabetes. My A1C is, I think, in pre-diabetic range again, but I put in a lot of hard work. So when I tell you that these are scary institutions, I mean that they are scary. We shouldn't be drugging children with psychotropics. We shouldn't be um, filling their head with this nonsense of ADHD or, you know, schizophrenia. Kids are going to be kids. They're going to be whimsical. They're going to come up with different fun ways to play that might seem crazy to adults or mental health professionals. But, you know, if a kid is having trouble paying attention, maybe teach them about maybe your learning methods are fucking boring. Maybe, you know, maybe just let kids be kids. Maybe stop pushing psychotropics as the first line defense for every little issue. Maybe, you know, let people come to grips with their emotions and how they feel, or with any given experience, any given event in their life. It's sad to say, what we're doing now is we're numbing these emotions, we're numbing these experiences, and we're pathologizing them, calling them calling them disorders, or just, you know, just things that, you know, are in need of a pill. And yes, I believe that, you know, that pill pushing is what's really going on. The pharmaceuticals know just how risky the pharmaceutical industry knows just how risky these medications can be. And it's channels such as Dr. Joseph During, Mad in America, and people like Dr. Peter Bregan, Dr. Robert Whitaker, and Thomas Saz, many people, Joanne Moncrief, I'm not sure if I pronounced that right, who are rightfully critiquing this system. And, you know, I get it if you feel that you need the medications, but, you know, at the same time, I just feel scared for what you're going through. I empathize, and I fear for just what you're getting yourself into, or just, you know, however complacent you are with your mental state and whatever's going on. Like, but these are scary things. I mean, you can look up the black box warnings through the FDA. Those warning labels denote the most significant risk for those classes of medications. Nobody ever really looks at how diet can play a role. I mean, if you eat like shit, you're gonna feel and look like shit. I mean, and that goes for your mental health. There's a reason people use the phrase "you are what you eat," and if you eat like shit, you're gonna look and feel like shit. So, I don't judge people if they feel that the medication is helping them, but I want so much better for these types of consumers who are so locked into this system and so locked into this cycle of complacency and just trusting the system. I mean, I want so much better for them, but I realize that I can only really advocate for me. And I'll be honest, I am fearful of being back in a situation where I could be locked up in an acute unit or a state institution like I was. I mean, some will look at me and say, oh, he's delusional, just based on extrapolations from my history. And realistically, if you go based on the logic of psychiatry and its many systems, I should not have been able to come off my psychotropics, and not only that, I should not have been able to lead a normal, relatively sane existence as a neurodiverse man on the autism spectrum, and I should not have been able to lead a normal life. By those metrics, my risk of recidivism and re-entry into the mental health system, and ultimately transcarceration into state institutions is astronomically high. Yet here I sit before you, a man who was critical, who was trying to put the pieces back together and just do right for himself. I mean, these are heavy things. I was once far heavier. I was far more disinhibited. And now I can sit here talking at my camera with a relatively coherent state of mind. I like to think. I'm not delusional. I mean, I'm just critical. I've been burned. And I've been burned by this system. I'm jaded. I'm misanthropic. And I just want to do what's right for me. I love nothing more than sitting there playing a video game like Zelda or Dark Souls and just doing that. I love doing that. I just want to be able to do that and really not be bothered by people. I mean, as terrible as that sounds, I don't know. I don't know, man. My experience with this whole system, like, I just like to do my thing. I like the game. I like to just do what I enjoy. I mean, I don't find any enjoyment in digging up the past and my skeletons with psychiatry and my history with it. But I really only bring this up because, it's an experience that people need to hear. It's something that could be beneficial. Not many people are aware that these state asylums are still in operation in the limited capacity that they are. This was emotional for me, and it's hard to really sit here and speak out and speak my mind on this whole thing. I mean, it's not all pessimism and jaded thoughts, though. I mean, I do try to remain positive and optimistic, and I am, because I have come a long way. I've come from having the mental state of a child and essentially being mentally retarded to the man who sits before you and can intelligently articulate his thoughts and experiences with the system that burns so many. I have my critiques, to be certain, and I will end on this. I have at least come out of this a better person. The state institution did, the state hospital did, in the very least, get me set up with waiver supports for autism, for being an adult on the autism spectrum. Excuse me. So there is that. It's not an experience that I want to see people go through, But it's, again, it needs to be stated that, we are medicating people um, to the point where this can happen, and it's a scary thing. I don't like seeing people suffer. I don't like that I suffered, but it's more that I feel like I'm a victim of circumstance. I mean, it's unfortunate. I made a good life for myself with the ashes of what I've been through. I fight to stay on the straight and narrow and stay on a good, sane path. I mean, I have spirituality to thank for that. I mean, I have gaming that gives me an out to escape. I have being able to exercise and work out. My cat, Damien, who is walking around. Yeah, I'm not sure if the camera picked him up, but I have so much going for me, that um, I'm happy with all the progress that I've made, and I feel like I've become a better person, regardless of how negative it was. This has been a learning and growing experience for me. I was an immature child, and before I went through this, at least mentally. But I've grown into a respectable man and an individual who is capable of these sorts of critiques. So I realize a lot of this was heavy, and a lot of this is a bit raw. It's unfiltered. It's controversial. It's not what people like to hear, but it's my experience, and it's something that I feel, again, people need to be aware of. I mean, if you are a part of this mental health system, whether you work in it, you're a consumer, or whatever, I have no ill will towards you. You are just going based off of what you have been trained to do. If you're a consumer, you realistically would not have any means to or reason to critique this system or question, why. I mean, I know there's many who are not happy being medicated, and those who would want to do better for themselves, but if you feel that that's working for you, then that's fine. That's dandy. Do what you have to do. I'm not going to judge you. But I would like to present to you people like myself, and moreover, people like Dr. Joseph Witt-During, who is rightfully critical and who could give you more resources and better information, as he's worked with the FDA and the pharmaceutical companies. So he at least has that experience. I'm not educated or qualified to give mental health advice, but damn it, I have researched a fair amount, and I know enough to really I know enough to say that, this is not something that I condone. I may not know the ins and outs and every little nuance of things, but I'm trying to learn, and for me, the best I can do is advocate for myself. The past is the past. It is what it is, unfortunately. I've come out of it a stronger, better person, and you can too if you choose that path. My experience was, again, unfortunate, but if you're struggling, there's no shame. I mean, I might be jaded and misanthropic, but it's because I was traumatized. I was in a system where I despaired. I had no idea how long I was going to be in there. I could be in that state hospital for the rest of my life. for all I knew. It was a scary 4 years, and it really made me question, you know, just why are people medicated like this, you know? And, just why are we okay with locking people away like this? So, um, there is hope and there is resources available if you are critical, but it takes a lot of effort and a lot of work. It's not something that you can just taper down off your medications and say, oh, everything's fixed. No, you have to fix whatever is contributing to your issues, your diet, your psychological issues that may have initially contributed. You have to put in work. And like I said, try not to pathologize everyday aspects of the human conditions. These control disorders, um, these these disorders that pathologize grieving the loss of a loved one. No, don't believe that bullshit. If you feel like a little bit of fear, worry, or anxiety, that's normal. That's your body telling you that, hey, something not fun is happening, and be on edge. Something scary is afoot. If you're depressed, I believe that depression is more situational. It's not a chemical imbalance. It's more, I'm not happy in my marriage. I'm not happy in my career. I'm not happy because I'm not good with my interpersonal skills. I mean, there's many, many different things. But, again, this was a long ramble, and this is my thoughts on things. So I, again, am doing very well, and I don't plan to deviate from this path. I just do my thing, just me and my cat Damien, and I'm happy, Despite being jaded, despite being misanthropic, I am proud of the progress I have made, and I am proud of the man I have become. It's not an easy journey, but it's my experience. So, thank you for listening to me ramble. Like, share, subscribe if you enjoyed or if you resonate with this. And I don't post all that many videos, or rather upload, but I figured, there was several people asking for more of my stories, so here it is. Enjoy your morning.